as dentists, we talk about caries control or cavity control, and this is a topic that is very interesting to me because of the fact that despite the modern technology that we have today, despite living in a very modern country, we still have an epidemic of decay. We have children and adults who have multiple areas in their mouth with decay. And what it boils down to is a lack of understanding of how cavities develop and how they can be controlled. So one of the things that we do when patients come into our office for the first time is we evaluate what we call their caries risk or their cavity risk. What are the factors in their life that lead them to develop all these places of decay in their mouth? And a lot of that is something that is actually out of what we consider to be dentistry. It's diet related. And there is a correlation between what patients eat and how rapidly they develop decay. We have to analyze the patient's diet. We have to ask them questions. What are you eating? How often are you eating this? What kind of beverages are you drinking? What are your hygiene habits? Do you drink fluoridated water, or are you only drinking bottled water? There's all kinds of things that patients do. Nowadays, there are a lot of people who are into fitness and they're drinking a lot of sports drinks. So things like Gatorade and these sports drinks and even the pre-workout drinks have a significant amount of sugar in them. And ironically, the patient who's thinking that they're doing something to be healthy and fit is actually now putting a lot of sugar on their teeth and in their body. So these are things that we constantly are looking at and evaluating so that we have the information to give to our patients and identify what it is that's happening, because again, we're really about fixing something and helping it stay fixed. We don't want it to fall apart. And if we don't address how it got there in the first place, we're really just patching things up. We're really not making a change in the patient's life. We're not really making a long-term change in their oral health. So until we're able to really analyze why it happened initially, we're not really going to be helping that patient. So caries control is a big portion of it. And part of what caries control involves, in some cases, is certain types of toothpastes with fluoride or with other products that are coming out that help disrupt the bacteria's ability to create a cavity. So without getting too technical, because that's my job to read all the technical stuff, there is a lot of great science out there nowadays, and it just involves having the right team to tell you, hey, this is what you need to be using so that you're not going to have a lot of these things falling apart and so that you can keep your teeth healthy.